Hey everybody, welcome back. This is Dental Unfiltered. I'm here with my new normal co-host, Dr. Andrew Vallo. And today we have a really cool subject that I think is really important. How to handle dental conflict resolution, especially around the team, because when teams start having conflict, it can become a cancer and it can hurt every aspect of the practice. It can create turnover. Conflict in the practice can be a very devastating, damaging thing. And it's something that you have to handle right away and have a really good intentional process. So, Dr. Vallo, what brought this up and tell me some of your insights on dental conflict resolution amongst the team.
So, I had mentioned in another episode, Matt, that this year I am really trying to invest into myself and into my organization, my leaders. Basically, I am focused on creating stronger leadership, stronger business acumen, more sophistication. I think at our size, and honestly, I wish I would have done all this stuff earlier. But I think at our size at this point, I really have no choice. So we can't have broken systems. We can't have inconsistencies. We can't have toxicity within offices. We can't have low morale. We can't have high team turnover. Which honestly, for the size of our organization, I feel like our turnover is pretty low. I think overall we do a pretty good job of creating a good work environment and keeping people excited and motivated and all that stuff. But we always have room for growth, and we're definitely not perfect there. And so this has been a focus for me this year. I'm continuing in multiple mastermind groups. I'm taking advanced business and leadership training. And this idea of conflict resolution actually came out from a recent leadership lecture that I attended. I've been doing some work with Tower Leadership, and so it was a really cool topic. Basically, it was a whole day about conflict resolution, and I'm not usually a huge note taker. Usually if I'm at a lecture or a seminar, I'm taking a couple key points down or something like that. But I feel like I was scribbling like a madman during this event. And I actually, when I got back, I took like an hour to go through all my notes and essentially rewrite them into an email format that I sent to all the leaders in my organization. Like, hey, this is our new leadership manifesto. This is what I took from this lecture that I went to. And these are some of the ideas I have for us to continue to move forward. And again, one of the major topics, one of the major themes of the day was conflict resolution. And basically, it was talking about how in a lot of businesses, but especially in dental offices that don't often have a strong leadership or business acumen, there is a lack of process when it comes to conflict resolution. And that is one of the major causes of turnover, of turmoil, of bad reviews. I mean, again, patients, they can pick up on vibes. And honestly, conflict resolution could be applied to both patient conflict with the office as well as conflict within the office between team members. But I think, one of the key things, one of the key takeaways that I want to talk about for a second was how we prepare for these conversations about conflict. I think everyone kind of has their own approach for dealing with conflict. I know a lot of us like to avoid it. That was me for a long time. And in all fairness, at this point in my career, I often do get to avoid it because it's often not me directly involved in the conflict. Usually, if I am directly involved in the conflict at this point, it's a pretty big deal. It's a key employee. It's a major issue, whatever it is. But typically it is our office managers, regional manager, operations officer. They're usually the ones who are dealing with the conflict. But as an organization, we have been moving towards the idea of we need to squash conflict as soon as it arises. So we used to allow it to go on a lot longer than it should have. We used to allow it to fester. We used to allow it to brew. We kept toxic employees longer than we should have. We, let things kind of get swept under the rug when people were mad at each other and just hope that they would, kind of get over it. And it can be frustrating because, at the end of the day, sometimes honestly, you feel like a high school principal or teacher, guidance counselor or whatever. And you're like, guys, like, can't we just like be adult? Like this is work. Can't we just come in and work? And I think in my mind, that's how I thought it should be. I thought everyone should just get along and, hey, you don't have to be friends, but just like get along, be respectful, go to work, do your work, go home. And then you don't have to deal with the people outside work. But unfortunately, we got to realize we spend so much time with these people. Our jobs, our careers are a big portion of our lives. And I think our team members deserve to be happy. And if they're not happy, they're probably going to look to go somewhere else. So I think by having systems in place that address conflict, that address it quickly, that don't allow it to brew over or boil over, I think that's going to decrease turnover. It's going to allow you to keep those great team members who otherwise might go try to find another environment to work in. So anyways, that's kind of a little bit of background there. One of the things they talked about that I thought was really, really cool, and that we are in the process of rolling out here soon at my group, is a conflict resolution form. And so it's a simple 1-page form that basically you've got to fill out before you address a conflict. So, it can be filled out by the office manager who's going to sit down to have a conversation with somebody about an issue that's going on with another employee. It can be filled out by that employee who's going to sit down with an office manager to discuss something. But basically, this form makes sure you're in the right headspace. You basically have to take the time to write out what the issue is, who's involved in the issue, what do you really think their intention was? So, it's getting down to like the idea of we should question actions or ideas, but we should not question people or their intentions. So, like it's making you think a little bit deeper, like, did that person really mean to offend me? Or were they simply trying to make sure that patient was taken care of? So you've got to write down what you really think their intention was. And the idea is you're supposed to try to give them the benefit of the doubt. Like, this should be a good thing. What do you think they were really trying to do here that caused this, conflict? And then there's some other things on the sheet as well, that, talk about different like outcomes, like what's an ideal outcome, what would you like to happen? And so it's not this super complex form. I mean, I think there's maybe 6 or 7 categories to fill out. But what it does is it prevents you from going into a conversation unprepared or hot-headed or biased or whatever it is. And so it's going to be a requirement now in our organization. It's going to be an expectation that before any conflict is addressed, that these forms are filled out. And so we've already got a policy about mutual respect, and basically it's an anti-gossip policy. It's if you've got a problem, you don't just trash your coworker in front of other people. You've got to go through the right channels. And so this is like adding another level to that. So this is like, hey, if you got a problem, not only are you not gossiping, but you're not just coming to your office manager and venting about how horrible this coworker is and all the bad stuff that they're doing, and why don't they respect you and all this other stuff. You're actually having to sit down and kind of get into a more reflective headspace about what the issue really is, what that person was really trying to do, what outcome you'd like to see. And then you can sit down and you can approach, your office manager, supervisor, whatever, in a more calm, collected, logical, thoughtful type of way. The other hope is that just by having this form, it's going to make some people realize, you know what, I'm being silly. This is, this really isn't a big issue. I'm making a bigger issue than this was. I don't think this was this person's intention. I really don't have a problem here. So, hopefully it's actually going to stop some conflicts before they even get to that point where a conversation needs to be had. But same thing for our office managers. Like, let's say one of our office managers, gets word that there's an issue, with an employee or whatever it is. Before they sit down to have that difficult conversation, they're filling this out to get in the right headspace. And like part of the exercise has to do with like flipping the script. So basically, whenever we have a thought in our mind, about how another person, feels or is doing something, we need to kind of flip that on ourselves. And an example of that could be this employee just doesn't care about the practice. And like you catch yourself thinking that, like, what am I thinking? And then you flip it on yourself and you say, I don't care about this employee's success within the practice, or I don't care enough about this. So, it's doing some kind of deep self-reflection as well before we address these. If we can disarm ourselves before we go into a conflict resolution conversation, it's just going to make it a lot calmer of a conversation there. And it should allow us to help disarm the other person as well. Another thing that was discussed that we're going to really try to work on in the organization is the type of conversation that we have. So as Eric Morin had pointed out, he's the leader of or founder of Tower Leadership, but he had mentioned that there's ABC conversation, there's APC, adult, parent, and child. So, a lot of times when there's a conflict conversation, it is like child to child conversation. Somebody is essentially like, yelling at the other person, you don't care about me and you don't do this and you don't support me. And then the other person is yelling right back, well, you don't do your job and whatever else it is. If you approach a situation, a conflict with a child tone, you're likely to get that child response back. The second type of conversation is parent-child. So that's where one person is, not speaking like a child, but instead like the parent, and they're kind of scolding the other person. And if you approach a conflict like a parent and you're scolding that person, you're going to get a response back like a child. So, he talked about how the goal always needs to be, we need to have adult to adult conversations. So we need to approach the conflict in an adult tone, in a respectful way, not throwing out accusations, not scolding somebody, but just saying, hey, like, we need to have a difficult conversation here. This has been going on. This is causing these problems. Why do you think this is happening? How can I help you so that this doesn't continue to happen? That type of a thing. And, he even talked about kind of disarming by asking some of these questions up front. Like, would it be okay if I had a difficult conversation? Like, you're basically asking for permission. Would it be okay if I challenge this idea that you have? Would it be okay if I offer my opinion here? So it's the same thing we're kind of taught with patients with treatment, diagnosis and presentation. Would it be okay if I point out everything that I see here? Once you get someone's permission, they're going to let their guards down. Now at this point, you've politely asked if you can have this conversation. They don't feel like they're just being attacked. So anyways, this is just the tip of the iceberg, guys. It was a really, really content-packed seminar. And again, I took a whole bunch of notes, but I think kind of the starting point for us is doing some training starting with the leadership team. But again, we're going to do something on conflict resolution at our annual company-wide summit this summer, but doing some training with our office managers, the rest of our executive team. And I brought my operations officer, Manny, I brought him to this lecture as well. So I think it was really impactful for both of us to be present and kind of see it. And Manny went up and did some role playing during the lecture with Eric, who was giving the lecture. So they did some role playing on some conflict resolution. I thought Manny is honestly much better at that than I am. I think I've got more to work on than he does. I think he did a killer job.
Manny is a very compassionate, understanding person. I've had to deal with.
Oh yeah, yeah.
He's like a barometer for human mood. Like, I picked up on it like very quickly. Like, we were talking at dinner one night, and I was like, this guy's great at navigating people on like a compassionate, understanding them, helping them level.
Yeah, no, I totally agree. So anyways, guys, I wanted to at least give you a little bit of insight here before anyone reaches out to me. I can't or don't feel comfortable sharing this conflict resolution form because, again, this is something I got directly from this course with Tower. So if you're interested in learning more, I'd recommend reaching out to them. I've only been working with them for a short time. I've attended a couple of their lectures now, but I really do feel like it's been impactful. I am the type of person where I want to learn as much from as many smart people as possible. So I don't like jump from one thing to the next thing to the next thing. I've been more kind of adding, additional things. So I get a lot out of my DSI mastermind group I'm in. I'm going to be attending for the first time the Bulletproof Dental Summit this August. So if you're going to be there, feel free to come up and say hi. That'll be my first time, checking out what Craig and Peter have to say, but I'm excited for that. I truly believe that the more you invest in yourself, the more you grow as a leader, the more the potential for your organization as far as growth goes. So that is my thing. I'm trying to invest in myself and some of our leaders to one up our game. The thing I've really liked about working with Tower so far, and again, guys, no affiliation, no kickbacks, no referral bonuses, nothing. This is just my experience so far with this group. But what I've liked about them is while they are dental specific, like they do cater to dentists, I feel like their content is more applicable to business in general. And so I feel like a lot of what I've gotten through different dental business seminars and podcasts, and I mean, honestly, guys, even our podcast is pretty dental focused. While they do talk about dentistry specifically, the big picture there is more how good businesses run. They do case studies on all kinds of different businesses. They talk about key opinion leaders in the business world, not just in the dental business world, that type of a thing. And at the end of the day, guys, while there are nuances to running a dental business, there are a lot of similarities. And honestly, I think there's a lot of things that the dental business gets wrong that we could learn from other industries. And so like, that's what's been most interesting and exciting to me is I feel like I'm getting, this kind of abbreviated MBA learning about business practices in general, and then how can I apply them to my dental group. So that's been really cool. I'll keep you guys updated on how kind of some of our new conflict resolution policies go within the organization. But essentially, my goal, again, I always set realistic timelines. My goal over the next 6 months here, by the end of 2025, I would like to have it standard practice. Everyone's using our conflict resolution forms. There's less conflict in general. There's less turmoil. There's less turnover. Again, not that I feel like ours is bad right now, but I do think our culture could be even better if we could do a better job of addressing conflict resolution as leaders. And if we can train everyone in the organization, not just the managers, not just the executive team, but if all of our team members can learn better conflict resolution and experience personal growth in their mindset, I think it's going to make it a better place for everybody, including the patients, because you won't have those circumstances where there's tension in an office. And again, people can pretend that no one picks up on it. People can pretend like, that, they're putting on their facade. But when there's tension between team members in a business, people pick up on it, man. I mean, think about anywhere you go. If you're in a store or a restaurant and there's tension going on between coworkers there, you can feel it. It's like a whole vibe. I mean, you pick up on it. So there's no place for that in our dental offices. And the more we can do to address that ahead of time, the better it's going to be. So yeah, we'll wrap. This was a quick one, guys. I think it's an important topic. If it's not something you thought about, I definitely recommend giving it some more thought. Anyways, as always, we appreciate you listening. If you enjoy the podcast, please do us a favor, hit the follow, share with friends, share with other dentists. Leave us a review. Those are super helpful for our algorithms so that more people find our podcast. And as always, tune in next time. Thanks, guys.